The latest technology in fetal medicine has helped us in improving the outcome and hence the dream of a healthy baby. With these opening remarks, I invite all the dignitaries on the dais. May I invite Dr. Milind Shah sir, dynamic personality, to escort Mr. Rajkumar Meghnathan sir, Chief Guest, Police Commissioner, Solapur City. May I request our President, Dr. Neeta Ghate Madam, to escort our beloved President FOGSI, Dr. Jaideep Tang sir, and take her seat as well. I invite Dr. Monica, Organizing Secretary for this conference, to escort Dr. Madhuri Patel Madam, Secretary FOGSI. Welcome, Madam. I request Dr. Amruta Kumtekar, our Secretary, and Dr. Chandrakant Zadhav to please come on the dais and take the seat. We are also very happy to welcome our co-organizing chairpersons, Dr. Rohini Deshpande Madam, Dr. Tirankar Madam, and Dr. Rajiv Dabde Sir. All the organizing committee members have taken immense efforts to make this conference a unique one. Now I request our President of Solapur OBGY Society, Dr. Neeta Ghate Madam, to deliver the welcome speech. Madam is a practicing obstetrician and gynecologist since 29 years. She is practicing in Markande Sahakari Rugnalaya. She is a CPS teacher since 17 years. Over to you, Madam.
Good afternoon, one and all. I welcome all of you for FOGSI conference. The theme is Fetus as a Patient. First of all, theme of the conference is very innovative, to include and perceive the fetus who is in the womb of mother. With the help of recent technology in ultrasonography and various biomedical tests, we can find out whether baby is all right, healthy in the womb of mother. Various intrauterine procedures we can find and treat the fetus before delivery. We assist fetus to live healthy when it delivers. Journey of the fetus starts right from the conception, and various genetic problems and mapping of the genes of the baby we can do beforehand. We also give parents advice whether this baby can survive or not. We also give treatment option of abortion if baby is having severe mortal congenital anomalies. Our technology and fetal medicine is so advanced that previously the things are invisible. Now every diagnosis made visible by fetal medicine specialist. Our dynamic chairman of the conference, Dr. Milind Shah sir, make the things happen in very short period and doing hard work for the success of conference. I mention our conference support persons, Dr. Dabde sir, Dr. Rohini madam, Dr. Monica Umardan, Dr. Amruta, Dr. Chandrakant for the success of the conference. I welcome President of FOGSI, Dr. Jaideep Tang sir, for coming all the way for the conference to Solapur. I welcome all faculties to come all the way to attend the workshop. I hope this conference give us vision as well as cultural and academic feast for all delegates. For the first time, we are having the simulators and hands-on intrauterine procedures, and we can enjoy the workshops also. Thank you so much.
Thank you so much, Madam, for those kind words. It's our privilege and honor to felicitate the stalwarts who have taken out their precious time and has graced this occasion. I request our chairperson, Dr. Milind Shah sir, to felicitate our chief guest, Commissioner of Police, Mr. Rajkumar Meghnathan sir. Thank you, sir. I request our loving Dr. Rohini Deshpande Madam to felicitate Dr. Jaideep Tang sir, our FOGSI president. Thank you, madam. I request Dr. Rajiv Dabde sir to felicitate Secretary General of FOGSI, Dr. Madhuri Patel madam. Thank you, sir. I request Dr. Neeta Ghate madam to felicitate Dr. Milind Shah sir on behalf of our society. Thank you, madam. I request now Dr. Milind Shah sir to felicitate our secretary Dr. Amruta Kumthekar and Dr. Chandrakant Zadhav, who has taken lots of efforts for this conference. Thank you, sir. Now I request Dr. Neeta Ghate madam and Dr. Milind Shah sir to felicitate our co-chairpersons. Dr. Rohini Deshpande madam, please. Dr. Dabde sir and Dr. Tirankar madam, please join so that we can have a joint photograph for all the chairpersons.
Thank you everyone for the kind acceptance. I welcome Dr. Supriya Jadhav, Koel of our society, for the Saraswati Vandana.
Thank you, ma'am.
I request Dr. Milind Shah and Dr. Neeta Ghate to felicitate our dear organizing secretary, one-man army of our society, Dr. Monica Umbardan. A big applause for her. She has great contribution in arranging this conference. Now Dr. Supriya Jadhav will present the Saraswati Vandana.
या कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिर्देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसार परमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदां जाड्यान्धकारापहा हस्ते स्फाटिकमालिकं विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदां बुद्धिप्रदां शारदां.
Thank you,
everyone.
Dr. Supriya. We are really mesmerized with your voice. Actually, she was not feeling well, but she acknowledged. I request Dr. Milinsha to felicitate Dr. Supriya. Now I invite all the dignitaries to come forward for the Deep Prajwalan, the auspicious lamp lighting ceremony.
Light is considered as a symbol of auspiciousness, prosperity, and abundance. Light brings brightness with it and dispels darkness.
शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय
हे तू म्हणायचं मी हे
दीपज्योतिर्नमोस्तुते दीपज्योतिर्नमोस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोस्तुते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्राश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठेत् गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरुत्वं कल्याणम्.
On behalf of Solapur OBGY Society, I thank all of you from the bottom of my heart for being with us today. I request all the dignitaries to please be seated.
Now, I request the pillar of our society, Dr. Rajiv Dabde sir, to introduce Dr. Milind Shah sir.
We all know Dr. Milind Shah, but just for the benefit of our guest, okay, I'm just announcing the names of the associations with which he is attached. Indian Society of Perinatology and Reproductive Biology, Asia Oceania Federation of OBGY. He has been the president of Indian Medical Association Solapur branch, Infertility and High Risk Foundation. He is also honorary secretary of Federation of Asia Oceania Perinatal Societies. Then he has been the vice president of our central organization, that is Federation of All Gynecological Societies of India. He is president-elect of Indian Society of Prenatal Diagnosis and Fetal Therapy. He is ex-chairman of Rural Obstetric Committee of FOGSI. He is peer reviewer of Indian Journal of Obstetrics and Gynecology. He is professor and head of the department at Gandhinatha H Medical College. And I don't find any country in the world where he has not visited. He has authored a book, Hypertensive Disorders in Pregnancy and Pelvic Organ Prolapse. He has published many national and international scientific papers on he has in his credit. And he is a hardcore Rotarian. I'm just going to speak two more lines which are not mentioned in this biodata. That he follows the culture of Rotary. Absolutely disciplined person. I have never seen him talking in any rude language to anybody for last 25 years. And to let you all know, he is much senior to me, though he may appear junior to me. Okay. Because every time he visits a foreign country for his lecture, he comes back and becomes more and more younger. I think. That's all, Milind Shah.
Unique introduction. Now I request Dr. Milind Shah sir to deliver his welcome speech.
Well, friends, thank you very much. Thank you, Raju, for all those kind words. You know, friends, when they introduce you, they become a little more elaborative, and that's how it is, though we are friends since years. Today's chief guest, Mr. Raj Kumar, the police commissioner of city of Solapur, who protects Solapur city. So we definitely appreciate for his time he has given to inaugurate this particular conference. Our federation, which nurtures entire clan of 45,000 gynecologists, and the president, Dr. Jaideep Tank, who has come here. He had been here for so many programs and projects over years, but today, when sitting on the chair of president, when he's traveling length and breadth of the country, he was in Lucknow yesterday, tomorrow going to Noida, but still found some time to come to inaugurate this conference. Our Secretary General, Dr. Madhuri Patel, the President of Solapur OBGYN Society, Dr. Neeta, Secretary Dr. Amruta, Treasurer Dr. Chandrakant, and yes, single man army, everyone said, very true, Dr. Monica, who is supporting me for this particular event. We always need the friends together, and my three co-chairpersons, Dr. Rajiv, Dr. Vidya, and Dr. Rohini, were very supportive. But what I would say, especially all my friends who have traveled as faculty from all over the country, finding their own time. Dr. Raju is here. Yesterday he was in Vietnam. Can you believe? He came to Mumbai yesterday at 12 midnight and managed to come and came here to teach you amniocentesis and CVS. Dr. Sharad Gokte, Dr. Aniruddha, Dr. Ajit, Dr. Amit Karkhanis, the fraternity is his advocate, but going to address us on whether Fetus is really a patient. Dr. Vandana, again very popular actually OBGYN in the city of Solapur. Dr. Sachin from the Chennai. So many people, I may miss certain names, but all that youngster clan Sumit has brought. And that definitely gives a more grace to this particular conference. Now, people always will think why this theme was chosen. Because yes, this 9 months travel is always having a 9 challenges as well. And that's why one need to definitely respect that fetus with utmost things which we can do with our whatever knowledge we have. And this knowledge never stops at one place. Every day something new comes, and that's how that knowledge need to get percolated to the even rural people as well. With the same intention, we decided to hold this conference, and we got a wonderful support by Dr. Jaideep Tank and entire team of office bearers who decided to give this conference to the Solapur OBGYN Society. So I must say big thanks to FOGSI and the entire group of Solapur OBGYN Society, my teachers, my friends, my colleagues, and all my junior friends as well for this good opportunity. I'm requesting you all to please enjoy these 2 days with wonderful academic fest, wonderful enjoyment of cultural things which you are going to enjoy today evening, and of course a lot of hands-on things which you are going to learn today after this inauguration, where you can learn yourself on the mannequin how to do the procedures. So friends, thank you very much once again for this wonderful gathering. And though we are appearing here, there are 144 people who are actually in the various windows online who are watching this particular program. So in total, I'm so happy that we got almost 244 registrations for this conference, which was a definitely mammoth task. But again, supported by Jaideep, he had a faith on us and he said, yes, you can do it, and the support of all these friends, we could do that. Thank you very much.
Thank you, sir. Whenever you organize a conference, it's always unique, and we have the best of the faculties. And also this time, we have arranged many times Fetus as a patient, but never we had arranged a workshop, and this time we have a unique workshop. Thank you for that, sir.
Now I request the most popular teacher of Solapur, Dr. Vidya Tirankar Madam, to introduce Vice President Dr. Ajay Mane sir. He will share a small video presentation after that.
Okay, we'll just have an
Introduction.
Good afternoon. I can introduce. So today I am introducing Dr. Ajay Mane. Currently he is the Vice President of FOGSI, Second Joint Secretary AMOGS. He is a member of National Inspection and Monitoring Committee, PCNDT Wing, Government of India. He is a medical legal consultant for the past 18 years. He is a chairperson for AMOG's website and Sexual Medicine Committee, FOGSI chairperson to Adolescent Health Education Committee. He is past president of Aurangabad Obstetric Gynec Society. He is ex-superintendent, MGM Medical College, Aurangabad, health advisor, Sports Authority of India, and charter president, Rotary Club of Aurangabad Elite. Thank you.
Thank you, madam. Now I request our fetal medicine expert, Dr. Sumit Chamaria, to introduce FOGSI chairpersons. And after that, we are going to display some of their videos.
These are related committees who did not come in person, but they have sent their wishes and blessings for this conference.
So there are almost 29 committees, as sir said, of FOGSI, and out of these there are 5 committees which are related to the theme of today's conference, that is the fetus as a patient. So these 5 committee chairpersons have sent their messages and good wishes, and it gives me great pleasure to present in front of you all. First one, Dr. मी थांबू का मागं थांबू खाली
This is Dr. Bela Bhatt.
Dr. Bela Bhatt, हाँ.
FOGSI Imaging Science Committee. The FOGSI conference at Solapur is one of a kind conference with the theme Fetus as a Patient. We all know how important it is these days to monitor the fetus throughout the pregnancy, in addition to the maternal care that we are already giving to the mother. In this conference, there will be a lot of important keynote addresses, oration by President FOGSI Dr. Jaideep Tang, interesting panel discussions and debates, in addition to so many scientific talks which will help give so many carry home messages to all the delegates to help them in their day-to-day practice. Well, I'm unfortunate because I will not be able to be a part of it, but my best wishes for this brilliant conference and congratulations to the organizing chairperson Dr. Milind Shah, Dr. Neeta Ghate, and the entire organizing team of this conference, as well as Solapur OG Society members, for shaping such a nice and useful conference for all the FOGSians. Solapur rocks, FOGSI rocks.
Congratulations to
Dr. Chinmay Ratha.
on organizing FETOCON 2024.
She is from the Perinatology Committee, Hyderabad.
This is a concept very dear to my heart, and I believe this is the science which is going to help make a better tomorrow. Congratulations, all the best.
Dr. Seema Pal, she's from Kolkata, and she is the chairperson of the Fetal Medicine and Genetics Committee.
I'm Dr. Sita Ramamurthy Pal from Kolkata and currently the chairperson of the Genetics and Fetal Medicine Committee, FOGSI. Wishing Dr. Milind Shah and the entire Solapur team for this very thoughtful and fascinating theme of the conference, Fetus as a Patient. Fetus as a patient is actually gaining a lot of popularity in our medical community, and I'm sure this conference is going to bring great insights as to how to manage our fetuses and the mother together to improve our perinatal outcome overall. The scientific agenda looks very promising, and I'm very happy to see 2 of my committee members Dr. Vandana Bansal and Dr. Megha Kamlapurkar as part of this conference. I'm sure this conference is going to be a huge academic feast, and I hope it brings about meaningful changes as to how we manage our fetuses on the whole. So once again, wishing the entire team all the very best, and I'm sure this conference is going to be a huge success. Thank you.
Dr. Poonam Goyal.
Hi dear all, Namaskar. I am Dr. Poonam Goyal from Delhi and I am currently chairperson of Safe Motherhood Committee. Wishing Dr. Milind Shah and the Solapur Society the very best for your event on the impactful topic and theme of fetus as a patient. Your dedication to advancing maternal fetal care is truly inspiring. May this initiative create meaningful change and empower the medical community to nurture the unborn with exceptional care. Best wishes for a successful and transformative event, and I wish a happy brainstorming to all of you. You will create history. Thank you.
Yes. Yes.
Good
Thank
evening.
you.
I am Dr.
Take
Mitra
care.
Saxena, Chairperson of Practical Obstetrics Committee. I am delighted to congratulate Dr. Milind Shah and the whole team of organizers of the Solapur Society to have planned and now are going to execute this phenomenal conference on fetus as a patient. Extremely thoughtful of our President, Dr. Jaideep Tang, to plan this national conference. With the evolving technology and the knowledge now of detecting intrauterine problems, I'm sure there is a growing tussle between the rights of the fetus and the maternal autonomy. What is available to us so that we can give a good outcome to the fetus who is not perfect, but yet will be able to survive with dignity and with a long life. So friends, I am really keen if this could be a hybrid, all of us could also enjoy this wonderful Congress. My best wishes to the faculty and all those who are going to attend, that this is a very dedicated conference and all of us are going to learn something really new and that which is relevant for us in our practice. All the best. Congratulations in advance.
Yes. So we thank all the chairpersons and
Yes.
all the committee members for their good wishes. Thank you.
Yeah, thank you, Sumit. May I invite our evergreen personality, Dr. Rohini Deshpande Madam, to introduce our chief guest, Mr. Rajkumar Sir.
Good afternoon, everybody. I am really very happy to be here and I'm honored to present your biodata. It looks very impressive. I'm very happy to introduce you, Mr. Rajkumar Meghnathan, the Police Commissioner of Solapur City. Actually, he hails from Chennai, but he has been selected from Maharashtra cadre as an IPS, and we are very proud of him. He has had postings at various places like Satara, Umarga, Gadchiroli, Mumbai, Nagpur, Yavatmal, Nagpur again, then in Jalgaon, and now in Solapur city. We are very happy to have you here. He has been given a lot of medals, and out of that, the distinguished medal is a Shaurya Padak, which was awarded in 2017. Then Police Medal for Gallantry, Bavan, on 26th of Jan 2018. Then DGP's Insignia on 1st of May 2018. And let me also say that he's a very disciplined, very simple person and very fit. He is a great marathoner, and he not only he runs alone, but he takes his family also with him. That's a great thing. Really, we are proud to have you. Thank you very much for being with us.
Thank you, Madam. May I request our chief guest to please enlighten us?
Thank you, Doctor, for your lavish introduction. And I don't know how I can enlighten this hall. So, respected dignitaries on the dais, Dr. Tank, Dr. Shah, and all others, respected doctors, good evening one and all. First of all, I'd like to excuse myself since I have another schedule. I have just changed the order of the speeches, it seems. So, thank you for accommodating my request. And when Dr. Shah and his team came over to invite me here, the first question which flashed me, and I openly asked him as well, in which capacity you want me to come? As a person who expects care from you people, or what? so he was like, we also have interactions with the police department, so at least on that capacity we want you to be here. So I'm here on these two counts. OBs and gynecologists, yes, we need you. And at times you need me. I wish you don't. So I'll just touch the first part. The most important reason is to place on record my gratitude, my family's and the society's gratitude towards the services you provide at times of need and in times of contingencies, wherein you place all your priorities in the back seat and you rush out to take care and help out people like us who need you. So thank you so much for that. And again, on the same count, I have a personal experience to share as well. I guess, and I sincerely hope, I'm not here for any name calling or whatever. So I have two daughters, two beautiful daughters, healthy daughters. And the first daughter was a cesarean born, healthy mom, young, first conception, all through the pregnancy everything was fine. And on the D-Day projected by the machine, doctor said no, we'll have to cut today. So that was a cesarean birth. For the second, I won't take credit for it, but my wife, she had been researching a lot, studying a lot, and she said no, I'm going to try for natural. We were like, I'm going to try is not the word here. So let the doctor decide. But the moment we discussed with our caregiver about planning for a VBAC, the immediate reaction, you might well know. नहीं वो तो चांस ही नहीं है, and वो पुराना स्टिच अभी फट जाएगी. So there were many other reasons, but we were kind of hellbent. So he said, okay, till the D-Day, we won't disturb. We'll be there. And they were very kind, very well learned, reputed doctors. And we are still thankful to them. And we will be forever. On the D-Day, we went there and EDD, right? So they had an ultrasound done and said, everything is fine. So pack your bags and come. So we packed our bags and we went to Hyderabad. And there was another center. It was manned by a midwife. Of course, they had a emergency arrangement in the same floor, manned by, of course, OBs and GYs. So the EDD was 4th of December, and the kid came out when the kid and the mom decided to come, decided to have the delivery on 18th of December. No any intervention. I was in the room watching. It was a beautiful experience. I wish you help many more couples have this experience. So, as I already mentioned, no complaints. We are grateful to the doctors who treated us, who provided us care. But in the back of the mind, there is always a question, why cut the first time? The reasons are kind of the same. You just Google out, it spits out a number of reasons. The top things being there might be a cord, the water will be reduced, or the child might excrete. The top three I'm mentioning. So I'm placing this personal experience in front of this August gathering so that there be some food for thought, and I wish VBAC is not a very lesser known term. Let it become common. If there is any complication and if there is a need for intervention in the first delivery, and the second delivery can very well be a VBAC. And we stand testimony for that. So, and on the second part, please feel free to speak to your local caregiver on the legal side. At least as on date, or at least for another 50 years in a society like India, if there is one person who is a very power wielding person, it will be the local Tanedar, whosoever may be it. But the Indian legal system provides, or rather bestows him or her with lots of powers. Some people approach me, sir, case dakal karna hai. I say, I can't do it. If you go to the local police station, only the Tanedar can do it. I might sit in a very better equipped and posh office, but no FIR can be registered at my office. It has to be done in the dimly lit Tanedar's chamber only. So have a connect with them. Because if something wrong happens, something goes wrong, we immediately rush to our, maybe in this case, you will ring up Dr. Milind Shah. So, either gardi ho gaya, gadbad ho raha hai. I think it will be better if we have a rapport, one-to-one. If you call a inspector for a cup of tea, maybe in the afternoon when you are not busy with your OPD, he'll be a very happy person to join. Because it is an honor for us. A doctor calling us, it will be an honor for him or her. And at the same time, it is a win-win situation. I think Dr. Jaideep will agree. See, without any problem, a police vehicle being parked in front of your office sends a message. I mean it. So, being friends with a police officer is at times beneficial. And when in contingencies, it is really. And instead of, I rang up the control. I didn't get the petrol van, after 12 minutes, after 14 minutes, whatever. Instead of it, have the mobile number of the local Tanedar. I mean, in most cases, our officers, उनका बच्चे क्या कर रहे पूछ रहे तो they will be your junior only. Somehow my officers have a fascination towards your profession. अपने बच्चे क्या करते हैं सर, इधर MD पढ़ रहे, इधर MS पढ़ रहे, इधर MBBS चल रहा है. So in most cases, and they'll be looking up to have a word with you. And this 10 minutes which you invest maybe once in a trimester in your terms will go a long way if need there be. I wish there's no any need for you to call us in an emergency, but it really helps. I had been part of FOGSI's conference, I think in Yavatmal 2018. Then there was a question during a panel discussion. Sir, abhi gardi ho gaya to kya karna hai? Call your Tanedar. Do you have his number? He said, no, we don't. Get it, वो तो उधर ही रहने वाले हैं, आपके पास ही रहते हैं, और आपके ऑफिस के सामने डेली वो जाना आना हो सकता है, या आप उनके ऑफिस के सामने जाना आना होता है. Why don't you stop by? Your card has a lot of value, and nobody would dare to say अभी time नहीं है बाद में मिलता करके. Because when we say that you are not going to die, when you say that we might. So your card has a lot of value. You drop by at our place, or you can call my officers to your place. Max 10 minutes. एक चाय कितना समय गर्म रहेगा? So max 10 minutes, and that really helps. ये बाहर गाड़ी है ना, उसी में ही a lot of deterrence value is added to that. And if at all you need during a contingency, he will go that extra mile for you, he or she. So please be in touch, and whenever or whatever be it, if at all there is anything we can help you out with, we'll be more than happy to do that. And again, I place on record as an individual and as part of the society for all the services you provide our sincere gratitude. Thank you so much for inviting me for your wonderful function. And Fetus as patient, Fetus is for you, for us it's baby. So you are thinking about our yet to be born babies. Again, thank you so much. Jai Hind.
Thank you, sir, for really enlightening us. You are very humble. Yeah, and thank you for sharing your beautiful story also. On behalf of our society and this conference, I request Dr. Milind Shah, sir, to felicitate Mr. Rajkumar Meghnathan, sir. Thank you, sir. It was wonderful to have you. Actually, once again, we would like to thank Milind Shah, sir, Deshpande madam, and Ghate madam for inviting you. Actually, thank you. Now I request our ever helping treasurer who has helped to organize this conference, Dr. Chandrakant Zadav, to introduce Dr. Madhuri Patel, madam.
Thank you, madam, for giving me opportunity to introduce our beloved Secretary General of FOGSI, Dr. Madhuri Patel, madam. She is now a Secretary General of FOGSI. She is Editor-in-Chief of Journal of Obstetrics and Gynecology of India. As being a true FOGSian, she has many posts in the FOGSI. She is Joint Secretary in 2009, Committee Member of FIGO, Preterm Birth. He has also has a many attachment and consultant. Mention of that is he is honorary consultant at Police Hospital Mumbai, consultant at St. Elizabeth Hospital Mumbai, and former professor and HOD of MGM Mumbai. And also she has got many awards in her pockets. She has got the awarded as a MOGS, Dr. Gantra Charitable Medical Center Award for the promotion of social issues of women's health for the year 2022-23. Also got 2 DC Datta prizes for her textbooks updates in the obstetrics and gynecology as edited in 2024, and also for the new molecules and equipments and procedures in obstetrics and gynecology, which was also edited in 2024. He also delivered many guest lectures and has 50 and more publications in the national and international journals. And also she has associated editor of FOGSI Awards winning book Gynecological Cancers in 2007. I hope we are very happy to invite madam for this conference.
Yes, thank you, Dr. Chandrakant. Now I request Dr. Madhuri Patel, madam, Secretary FOGSI, to say a few words.
Thank you, Dr. Chandrakant, for your kind and warm words. Respected our President, Dr. Jaideep Tan, Dr. Milind Shah, Dr. Neeta, Dr. Monica, Dr. Amrita, Dr. Chandrakant, and of course I can see Dr. Vidya, Dr. Rajiv, Dr. Rohini, and all my dear friends. Very good evening to all of you. At the outset, I would like to thank the entire Solapur team for giving me this opportunity. It is my privilege to stand before you as a Secretary General of FOGSI and to address this August gathering. I always like to talk about FOGSI, that we are now 277 member bodies and 44,000 plus members committed to women's health. We have two policies, what you call as professional indemnity. I want all of you to take the benefit of it. And we have social security scheme. I want your nominee to take the benefit of it. Some of the other social security scheme we could not enroll our members. So it is, once the nominee gets only 4.5 lakhs. So we were not happy. So Dr. Jaideep and myself thought about it, and we are going to go for the group insurance policy. I hope it comes through in this January meeting. Then we have two academic wings, that is ICOG, Indian College of Obstetrician and Gynecologists, and Journal of OBGY of India. I'm very happy to share that since being a chief editor of this journal, we get so many queries. And of course, our journal is bi-monthly issue. It is on digital format as well as on the printed form. And this printed form is distributed all over India to our members free of cost. And I must tell you that I started as an editor-in-chief with permission of Dr. Jaideep Tang, Clinical Pulse of Yogi, where it is held on every third Wednesday between 4 to 6 p.m. And here we invite the authors, award-winning authors, to present their research work and interact with us and the other delegates. So it is a very, very good response we have got, and I request all of you to join between 4 to 6 on every third Wednesday of the month. And as far as our mission is concerned, that the mission is reduction in maternal mortality rate. We are 97 per 100,000 live birth today, and we are marching towards our sustainable development goal of 2030, less than 70 per 100,000 live birth. And WHO has predicted, and our government also has predicted, we'll reach the target goal much before 2030. I would like to say, since we are in Solapur and we are in Maharashtra state, that in one of the Delhi meeting we met the director, Dr. Deshpande, and he presented maternal mortality rate in Maharashtra. And he said we could bring down to 33 per 100,000 live births. And he analyzed and gave us a picture that why we could reduce to 33, because there are 99% institutional delivery, their infrastructure has been improved, and thirdly, they recruited many obstetricians for the same. And so they could bring down this maternal mortality to 33 per 100,000 live births. So now we are at 33 by 2030. It is our sincere appeal to everybody that we should bring down to single digit per 100,000 live births. For this, I give credit to government, our organization, and you all grassroots level workers who are doing this work and bringing down the maternal mortality rate. So we should appreciate ourselves, and I acknowledge and congratulate all of you for the same. We have many, because we know the PPH and anemia are the major cause. I'm not saying much about it, but many projects are going on that, and Jaideep will talk about his BMJ. If he feels, he can talk. It's a very, very big project. Manyata is there. We have with FIGO. And so many projects are going on in FOGSI to bring down the maternal mortality rate. And of course, our biggest problem is cervical cancer. So we have added in our mission preventive oncology and elimination of cervical cancer. And I would like to say, when Dr. Shanta Kumari was president and myself as a secretary general, we had a meeting with the government official in 2021, and we advocated HPV vaccine. And you all are aware that our finance minister that time has declared about 6 months back budget for HPV vaccines. And very near future, we are going to see it is in the national immunization program. And I'm really thankful all of you are working so hard so that it is noticed by government at the national level and also at the international level. Of course, Dr. Priya Ganesh just now said we had last year American Cancer Society, and we have trained more than 10,000 gynecologists on HPV vaccine. With Dr. Jaideep, we are having, also with the UNICEF, on our project. We are working on that on HPV vaccine. And with this, I would like to congratulate Team Solapur for the most apt conference and wish them best luck. And I would like to, always mention about quote by Nelson Mandela, education is the best weapon. When used, can change the world. So dear friends, use our education to update ourselves and give the best to our women. Thank you once again for giving me this.
Thank you so much, Madhuri Madam. Now I request our backbone of today's conference, Dr. Monica, to introduce FOGSI President Dr. Jaideep Tang sir.
Thank you, ma'am, so much for the opportunity to introduce my very own teacher, Dr. Jaideep Tang sir. Ma'am, because you mentioned Manyata, I would like to put on a note that I am a part of the district working committee of Manyata here in Solapur along with Rohini Deshpande madam. And Solapur district has more than 70% hospitals who are registered with Manyata. And most of them have already completed one term and they are into their renewal this year. Yes, sir. Let me begin with the introduction of our very own President FOGSI for the current year. Sir, thank you so much for allowing us to conduct this conference under your tenure. Sir is also the chairperson of the YGA committee of AOFOG. He is the project lead of FOGSI USID projects 20 to 24. He has been the Secretary General of FOGSI from the year 2018 to 21. He has also been awarded the FRSOG honoria causes by the Royal College of Obstetrician and Gynecologist. He has been the past president of the Mumbai OBGYN Society. He has also been the immediate past deputy secretary of Asia Oceania Federation of Obstetrics and Gynecology, the immediate past chair of the International Federation of Obstetrics and Gynecology, that is FIGO Committee for Safe Abortion, the past chair publication of newsletter committee AOFOG, the past chair of reproductive endocrinology in infertility committee, and to name, there are so many organizations that sir has been a part of and has held various positions and is currently at the helm of FOGSI. Sir is yet very, very humble and the most approachable teacher that I have met till date. And thank you, sir, for being my undergraduate and postgraduate teacher. Over to you, sir, for your words of wisdom.
Thank you very much, Monica, for that very, very kind and warm and very generous introduction. So I became the president of FOGSI in Hyderabad this year, in January. And at that time, when you become a president, you are traditionally supposed to give a presidential address. So I had given this very short presidential address for 42 minutes. But I will not speak that much today. I already told Milind I have an oration to follow. So let me first begin by congratulating Milind. Milind is a very dear old friend of mine. We've worked together for so many years on various issues. And it's always a pleasure to meet Milind and chat with him. So congratulations, Milind. I understand this conference was put together in around 20 or 30 days. So congratulations for achieving that. Thank you very much, Dr. Neeta, Dr. Amruta, and Dr. Chandrakant, office bearers of the Solapur Society. Thank you, Dr. Rohini, madam. I have known Dr. Rohini since so many years. I think there must be something in the water that she's drinking, but I know her since 25 years and I haven't seen madam changing in all these years. And of course, Dr. Rajiv and Dr. Vidya, and of course, Dr. Lalita and Monica, congratulations for putting this whole conference together. You know, we've done a lot of things this year. Dr. Patel, who is actually the first Lady Secretary General of FOGSI. And that's quite an achievement, I must tell you, and it's been a pleasure to work with her. As your police commissioner was speaking, and I wish he would have been around to hear me tell him this, that one of the problems that we as obstetricians face is that we don't talk about our own reasons for doing things. I like to call these things as narratives. And I think that somewhere we have probably not paid enough attention to these narratives. He talked about what a wonderful experience he had when he had a VBAC. And I actually wanted to tell him that I don't do VBACs. It sounds very strange coming from the president of FOGSI. But honestly, I don't do VBACs. I don't think it's worth the risk. I don't think it's worth the chance. And the patient is always welcome, as they did, to go somewhere else where that chance can be taken. And I would have just asked him to reflect on what would have happened if things would have gone the other way. Right? He had a beautiful experience, everything worked out well. But if by chance he would have fallen in that 2 to 4% of patients where a rupture would have happened, the fetus would have been lost and she had an emergency hysterectomy, I wonder if he would have had the same pleasant memories that he did. I'm pretty sure he wouldn't really have had those pleasant memories. Again, this is not to run down anybody. People who do VBAC are very welcome to do them. I don't do them in my practice. And this is because my father was an obstetrician and gynecologist, and he used to be called, and I used to be called after he was not there, to help many of our neighbors when they had trouble. And 8 times out of 10, the trouble used to come when a VBAC was attempted. Okay? The simple fact is that you cannot diagnose when rupture will occur, in whom rupture will occur, and at what point of time rupture will occur. So it is up to the individual patient to decide. And this is what I was saying about narratives. Now, he's the police commissioner. He's thoroughly convinced about VBACs, right? Tomorrow, if an accident happens during VBAC, he's more likely to blame the obstetrician by saying that you didn't monitor properly. So how do you convince people who have these preconceived or notions about birthing? So one of the things we are doing this year is, for example, coming out with a language guide, and this is already ready, where we are saying that, for example, there are many terminologies we have looked at, but one terminology we have looked at is normal delivery. And what we are saying is that don't call it normal delivery, because delivery is something which is done by Swiggy and Zomato. Okay, we are obstetricians, we assist birth. Call it a birth. And don't call a vaginal birth as a normal delivery, because if your section rate is 30 to 40%, then you are telling 30 to 40% of women who give birth that your birth was abnormal. And you're stigmatizing cesarean sections. I think you have to think of this broader outlook and then use the appropriate terminology. I know overnight people are not going to call it vaginal birth instead of normal delivery. I struggle to do it in my clinic. And when I say vaginal birth, sometimes patients look at me as if they don't understand what I'm saying. They're so used to normal delivery. But I think somewhere we have to start making a change. And this is part of the project that we are doing, which Dr. Patel mentioned. I'm very happy to say that this year FOGSI has received a very large grant from the Bill and Melinda Gates Foundation. We have received a grant of $2.7 million, which is 23.5 crore rupees. This is by far the largest grant which FOGSI has got. And in fact, I'm going to Noida tomorrow, Milind, because we are launching the project on the ground tomorrow. So again, thank you very much, everybody in the Solapur Society. I must acknowledge all the national faculties here. Dr. Sharad Gokte might not be known to some of the juniors, but when we were training, sir was the pioneer, if I may say so, of the way genetics was practiced. Dr. Raju just stepped out, Dr. Anirudh Vanna. Thank you all of you for making the time and being here. And of course, Amit is here, who will talk about this narrative of fetus as a patient. And let me just end by saying this, that when you talk about the fetus as a patient, keep in mind the language and terminology in mind, because we also have abortions, right? If we keep on talking too much about this, so the language, the terminology, the contextuality of everything is very, very important, and I would strongly urge you to remember that. Thank you very much.
Thank you so much, sir. May I request Dr. Amruta Kumtekar to present vote of thanks.
Respected Chief Guests, FOGSI President Dr. Jaideep Tang Sir, FOGSI Secretary General Dr. Madhuri Patel Madam, President Dr. Neeta Ghate Madam, Dr. Milind Shah Sir, Dr. Monica Umbardan, Dr. Chandrakant Jadhav, esteemed dignitaries, colleagues and dear audience. It is my privilege to extend our heartfelt gratitude to our Chief Guest, Police Commissioner Dr. Rajkumar, for honoring us with his presence and inspiring words. I sincerely thank FOGSI President Dr. Jaideep Tang Sir and Secretary General Dr. Madhuri Patel Madam for their valuable contributions and sparing time from their busy schedule and coming all the way to Solapur for our inauguration. A special note of thanks to SOGS President Dr. Neeta Ghate Madam, our conference organizing President Dr. Milind Shah Sir, and organizing Secretary Dr. Monica Umbardan, Treasurer Dr. Chandrakant Zadav for their dedicated leadership and guidance. I also wish to acknowledge the tireless efforts of everyone who has worked behind the scenes to make this conference a success. Though it is impossible to name each individual, please know that your contributions are deeply valued. Finally, a heartfelt thanks to our audience for your enthusiasm and active participation, which truly make this event meaningful. Thank you, everyone.
Thank you, Amruta. I request everyone to please stand up for national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Yeah, we declare the inaugural function is over, but we cannot declare it over unless we thank enough Dr. Nandam again, Dr. Sujata Kulkarni for wonderful efforts. I understand they have spent the entire half day while comparing this particular event. So thank you very much. It was really beautifully you have done it. Thank you.
We will be continuing with the session, the last talk of the workshop and Sir's oration in the same hall. And the two talks of the workshop will be also conducted in two halls, whereas the hands-on will be on the mezzanine floor in the Jal and Akash halls. We request some of you to start taking tea and snacks, and please come inside the hall and sit for the lecture to continue.